Hello, my name is Karen and I'm currently studying at Flinders University in their Bachelor of Clinical Science and Doctor of Medicine program. I'm currently in Adelaide, but I used to live in New Zealand and I came from Auckland. And I'm really excited to be starting university life here in Australia. I've always been passionate about medicine, especially since a young age where a lot of my family have been going in and out of hospital, and it really sparked my interest in beginning a career in medicine to be able to help other people just like the medical professional teams that were alongside us the whole entire way, helping us make decisions, informing us of the pros and cons of procedures, and it really allowed me to have a more holistic view on what health should really look like. Flinders University has a 6-year program and it allows me to do both a clinical science degree and a Doctor of Medicine degree. So it allows me to have 2 years of time to ease into medicine, whereas medicine is just very intense. So it allows me to have the time to develop useful study skills, be more productive with my time, make new friends in a new country, and just create those study groups that would help me to succeed in my future career in medicine. MedView has a really well-rounded service where there has someone with expertise in every single kind of university in Australia for medicine. So if I needed a tutor for Sydney University, there's someone that they could refer me onto and provide me with first-hand experience that they can give me and some tips in terms of how to succeed in the interviews, because they do have a basic understanding, and I guess because they've gone through the interview themselves, they could give me tips on what to avoid and things to remember to, emphasize in my own interview as well. So that was something I really enjoyed. And also MedView has a lot of resources, so they could refer me on to other people. And my manager, Yuzi, she was always there to make sure that I was on top of things, checking on with me in terms of what my ATAR score was, what my UCAT score was, and telling me the likelihood of me getting successful offers as well at the end. So for my experience, I had a manager called Yuzi. She was really nice and she really helped me be able to understand the process and how to apply, what to expect in terms of the MMI interviews or the panel interviews, and as well as the UCAT preparation. I also had a lot of UCAT tutors such as Owen, Max, and these people really helped me with getting my interviews as well. So helping me with these prospective schools such as UNSW, Sydney and Monash. And these schools were all schools that I got interviews at. By creating these strategies for me, it really helped me in really doing well in the interviews as well. Yeah, so MedView, because it's part of Crimson and it's really focused on medicine, that's something that I've been really wanting to help with as well, because I know that for New Zealand students going into Australian medicine, it's quite different and not many people do it. So to be able to contribute my first-hand experience to help other students as well, and also gain successful admission to their most desired schools, that is something that I hope to be able to achieve in the future as a domestic strategist working for MedView. Basically, for me as a domestic strategist, I help students from New Zealand and Australia apply to Australian medical schools, as well as dental schools if they are also interested. So what I do is give them some tips on what kind of strategies that we need to implement to be able to help them achieve their goals. For example, getting a UCAT score of over 3,000, getting an ATAR of 99 plus, and how to succeed in interviews by determining what kind of style that they're more catered to, so by preparing for the MMI or preparing for the panel interviews. So we're all making our students, more well-rounded and more able to be able to, face these different situations where they are more catered to a school that has a high ATAR but maybe doesn't require an interview, and that's when I would encourage my students to focus on their applications for those schools and make sure that they're able to succeed in the end. And for me, I've personally achieved a 99.95 ATAR, so I have some experience in terms of, especially as a New Zealand NCEA student, getting a good conversion into an Australian ATAR, because a lot of the time students often find it difficult of achieving achieving a high ATAR score. And so if I can pass on my knowledge and my personal experiences onto my students, I hope that they can also achieve a 99.95 as well. Yeah, so this year as an application year would be very stressful for you, but I know that if you stay on top of things, make sure that you still have a good work-life balance, because I believe that the extracurriculars that you're doing right now is going to definitely help you in terms of your interview as well, and also becoming a more well-rounded student, because you don't only want to be good at studying, you also want to be able to relate to your patients, to be able to understand things that are outside of the scope of medicine. So I believe that make sure you keep in contact with your friends and make sure that you have a good support network, because stress is going to happen, especially when it comes to interviews and also exams, and also I guess the UCAT practice as well. So yeah, making sure that you are on top of everything and making sure that you understand the content before moving on, so then you have a good chance of doing well in the actual exams. So MedView has a lot of people, as I said, who have expertise in their own respective fields. So if you want a good UCAT tutor, we can definitely find you someone who is able to cater to your learning style and cater to your queries, I guess. So if you are struggling with abstract reasoning, maybe a tutor who is really good at abstract reasoning can help you in that. And same goes for other sections as well. And for example, different interviews, Sydney has a very different interview style compared to other schools, and we have a lot of students who now work for MedView who can provide you with that help. So things like MMI interviews, a lot of students also are now teachers, and so these teachers can therefore help you as well. So I think for us, we're a very tight-knit network because we have all had personal experiences that have been really positive because of MedView. So our successful applications are examples that MedView is a perfect platform and perfect service to help you gain admission into your dream schools.